Hi everyone, welcome to another episode of Almost Normal. I was scrolling on my TikTok the other day and I came across a pretty disturbing video which I believe has gone viral now, so I'm sure many of you have seen it, but the video was in a location called the Sansum Clinic in Santa Barbara. The video entailed a group of female nurses going into the examination rooms once the patients had left and taking selfies with the little stain that the patient left on the paper on the bed and posting them on TikTok. Okay, the video was a montage of those pictures of the nurses making a funny face next to the liquid that the patient left on the bed. Now, this got a lot of backlash, as you can imagine. I was very shocked by it for a number of reasons. One is women have a dark, long history with the medical world. There is a long, long line of events that have caused women to suffer when it comes to having medical issues. We have very rarely been listened to. There was a long period of time where most things we were experiencing was just labeled as hysteria, which I'm going to get into later. Women have lost their lives because they are not taken seriously in the doctor's office. And you'd think, okay, this was ages ago, things have changed. But to be honest, they haven't really changed that much, especially for women of color. They are very, very rarely taken seriously when they go to a doctor with a problem. And I think that this video is very damaging because it's just adding a layer to this idea that there's something funny about a woman in a doctor's office. And there's something funny about vaginas. There's something funny about sexual health when it comes to women. Ha ha ha. Oh my god, look at like the stuff that came out of this patient's vagina and left it on the bed. Like, how funny is that? It just adds a layer of unseriousness to something that is extremely serious. And number two, these exams, and I've had more than I would like to say, these exams are so unpleasant. I think that you would find it extremely difficult to find any woman, I'm sure there's one or two, different strokes for different folks. I don't know, some people might not mind them that much, but I think you would find it pretty fucking difficult to find a woman who would voluntarily go for one of these exams. Not only are they uncomfortable and painful, but they're super unpleasant in the sense that you just feel so vulnerable in those rooms. To have no pants on, your legs in these stirrups, and then to have someone, most people don't know their doctors that well, to have basically a stranger in between your legs, really just shoving stuff up there. It's just a really vulnerable, uncomfortable place to be. And I have had probably 4 or 5 or 6 of these types of examinations. I remember pretty recently I had to have an internal ultrasound, which was just the same amount of unpleasantness. And I was fucking nervous because I was going for something that was nerve-wracking anyway. And the only reason I was ever able to get through one of those exams was because the doctor that I had, or the technician, made me feel so at ease, okay? She made me feel as if I was her best friend. I could tell her anything. We had known each other for years. Like, literally, we were not strangers. That's how she made me feel. And so I was able to get through those exams without freaking out. And another thing is that if you go into those exams stressed, I mean, of course you're going to be stressed, but even more stressed than, usual, your body tenses up. It makes the examination way harder. It makes it way longer. It makes it way more painful. And so the idea that this group of women thought it would be great to add another layer of fear for women to go into those exam rooms is insane, okay? We're already nervous. We're already feeling self-conscious. Is it hairy down there? Does it smell? Did I get my period? Like, we're already self-conscious. So the idea that we now have to think, oh, are these nurses going to start taking photographs of the room and post it on TikTok is absolutely abysmal. It is abysmal. I can't fathom. I have to know. I have to know. And I'm sure they'll get the answer to this soon. But I have to know, whose idea was it? Okay, who ran into the break room that day and said, you know what, guys, I have the best fucking idea ever. I have the best idea ever. You know what I'm going to do? I'm going to put my professional hat over there for a second and I'm going to focus on my TikTok career because this TikTok clearly was way more important to this person than their patients. The patient's confidentiality and privacy went out the window the second that person came up with that idea. They were thinking, let's make this TikTok. It's going to be fucking funny. We're going to get loads of likes, loads of followers, loads of comments. And then we can quit these jobs that we clearly don't respect at all. And we can become TikTok famous instead. I think that sounds like a great idea. That just seems like that was the mindset going on in that office that day. And the fact that about 4 or 5 other people agreed is just insane. Doesn't make any sense. It doesn't make any sense to me. And I will also say, we don't want to go to these exams as it is. As I said before, they're scary, uncomfortable, and they're a moment of vulnerability that most people don't wish to be in. But these exams are important. Important. I've had to have very serious conversations with people I know and say, I know it's terrifying, but you need to know what's going on down there. It is essential. The amount of women that have lost their lives due to the fact that they don't want to go into the doctor's office is way too many. It's way too many. People don't want to do these things. And so to make us want to do them even less now blows my mind. And it was a group of female nurses. Like, I would not say that I would be less offended if a group of men did it. I would probably be not more offended, but offended in a very, very different way. But I think the fact that it was an all-female group of people who did this is more confusing because are you saying, girl, you don't know what it feels like to be in those exams? Like, you're a female and you're a nurse, so I'm assuming that you've done these yourself because a responsible person does these exams, okay? They're fucking important. Your body can turn on you in any second. As a woman, it can be really scary in medical situations. So you're telling me that you know what it feels like, you're a medical professional, and you're a woman, and you still thought this was a good idea. Now, they didn't post the patients' faces, they didn't post the patients' names, but who gives a fuck, okay? Who cares? If I had a baby and then there was all that mess, and then someone came in with their iPhone and took a picture and posted it on Instagram, I would be fucking pissed. I would be pissed. And we don't know, okay? We don't know if those patients recognize those stains. You have no idea. You have no idea if that patient went on TikTok, saw it, and was like, I know that that was mine. I know that that was me in that room before. That is not a good feeling. That's fucked. So yes, it may seem like people are being a little dramatic about this whole situation, but actually, no, we're not. Because it's taken us steps and steps back from where we've tried to get from. I don't think anyone would have done this if it was rectal exams for men. I'm going to be honest with you. I don't think they would have done this. I don't think a group of men would have figured out that this would have been a really fucking funny idea. I don't. It's really, really giving a bunch of mean girls met in high school and all decided that they were going to bring this group, this clique to this clinic and then they just continued being these mean girls. That's what it's giving. It is not giving professionalism. It is not giving, oh, the patients come first. It is not giving any of that. It is giving, let's try and get fired from this job that we clearly hate so much and try and become TikTok famous. I was also told by someone on TikTok today that these were emergency appointments. These were emergency appointments, okay? These were not even routine checkups, which would have still been fucked up. But these were emergency appointments. These were appointments that women went to terrified. All right, I'm going to bring it back to history a little bit, and we're going to discuss the idea of hysteria, okay? So the word hysteria comes from the Greek word hystera, which literally means uterus. Ancient Greek physicians like Hippocrates thought that the uterus could wander around the woman's body and it would press on different organs, and that would be the reason why women would behave strangely or have strange ailments. Everything from fainting to anxiety. Crazily enough, this idea stuck for centuries and centuries, and any woman that was behaving abnormally would be labeled hysteric. Then we go to medieval and Renaissance era, which is where hysteria started to be linked to witchcraft and demonic possession in Europe. Women who experienced seizures, mood swings, or even were just dissatisfied in their marriage would be labeled as hysteric. And many, many women, pretty much most women that were labeled hysteric, were institutionalized instead of hospitalized and checked out for anything that could be going wrong. By the 19th century, hysteria was the biggest label for any women going into the doctor's office. It was one of the most common diagnoses. Symptoms included anxiety, irritability, insomnia, fainting, fluid retention, depression, sexual desire, or simply causing trouble. Doctors in this time would typically just say, oh, you have hysteria, in order to dismiss women and not have to give them any more thought. Okay, this is where it gets a little weirder. We come to the treatment part of the hysteria diagnoses. So, when women came into the doctor's office, a doctor or nurse would go into the room and perform a pelvic massage to induce what they called hysterical paroxysm. We know that by another term today. This treatment was medical therapy, okay? They considered it not to be sexual at all, though I can't see how that would be the case. After a while, however, doctors started to find this very tiring, very strenuous on the arms and hands, and so that, fun fact, is where the vibrator was invented in order to speed up the process of therapy. Another fun fact, actually, is that the vibrator was one of the first electronical household items that was sold. Literally before vacuums, before toasters, they were known as circulatory massagers. Then we get Freud. He came in and said, I don't know if this is a physical issue, it seems more of a psychological issue. And that is when he started to link the idea of hysteria with women's trauma or sexual conflict. And yes, this may seem like we were starting to be listened to, but Freud pathologized all of our experiences instead of actually listening to women. And then we get to the early 20th century, and the idea of hysteria really started to fade. We have a lot of feminist movements that were questioning basically everything. In 1952, it was taken out of the first edition of the DSM. Can't believe it was ever in there, but it was taken out. And why am I talking about this? Well, this was sort of one of the first recorded moments where women were really, really not listened to when it came to the medical questions and medical concerns. It was very much a tool of social control. Nothing more, really, than that. And I don't really believe the doctors even believed what they were saying. I think they just genuinely did not really want to listen to women in the doctor's office. This part of history is just very important to remember when it comes to this topic, because it shows how women's complaints were trivialized and sexualized rather than treated. And it really gave the doctors, who were all men at that time, a space to overlord women's bodies and not listen to their voices whatsoever. Then we can also look at the history of childbirth, where anesthesia was very, very recently, and no, I don't mean last year, but in terms of how long we've been giving birth, anesthesia is a very recent introduction. Queen Victoria made it acceptable for anesthesia to be introduced into labor. However, even these practices were not ideal. I think there's a long, long history of women's pain being ignored and also not really taken seriously, and definitely not given the time of day. I don't think a lot of men doctors, and all doctors back then were men, wanted to spend any time looking into how to make women's medical experiences any easier or better or more comfortable. It just is what it was. Or it just was what it was. Yeah. And to be honest, in today's medicine, there are a lot of things that are overlooked. You know, it's just made to work, but nothing really further than that. So, for example, the birth control pill, which I have been on since I was about 16 years old. I was told it was the best, safest option for me. In terms of birth control, it was the least invasive. I didn't have to have any injections. I didn't have to have anything put up my body or inside my arm or anything like that. They were just given to me. And as a 16-year-old girl with not a lot of experience in this, I really didn't ask that many questions. And I was on the pill a very, 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 very strong amount of hormones being put into your body every single day. I was taking that for the past 10 years, and I literally just went off of it, I think 3 months ago, which is wild. And I am a sufferer of mental health, and my sort of biggest demon when it comes to mental health is OCD and anxiety. And I have had days and days and days, and I'm pretty medicated for it. But I've had days and days and days, even on medication, when I couldn't get out of bed. I was so afraid of the world. Everything was a threat to me. I just felt like I was going to do something wrong all the time. I was going to hurt someone. I was going to hurt myself. It was really no way of living. And for the past 3 months, I have noticed that my symptoms have gone down dramatically. And I can only say that the only thing that I have changed is the fact that I have taken myself off of the pill. And the pill has so many problems, okay? So many problems, as does every single kind of contraceptive other than just using condoms. But it is interesting that all forms of contraceptive, they have problems, but they work. No one is doing a lot of research in order to improve them. And a lot of the forms of contraceptive, pretty much all of them except for condoms, which also could go either way, pretty much every form of contraceptive is the woman's responsibility, okay? It's the woman's responsibility. And then, if women get pregnant, everyone looks at the woman. Everyone looks at the woman. It's her fault. Do we not realize that there are two people in that situation, okay? Both as responsible as the other. It's just one person has to deal with the consequences much worse. And that's it, okay? That's it. And so don't you think the person that would suffer the most consequences from an unwanted pregnancy should probably be taken seriously? Okay? If you really, really don't want these unwanted pregnancies in America, maybe you should make it more pleasant for women to avoid that happening, okay? And then I move on to the topic of abortion, which is still being discussed today as to whether abortion should be legal or not. What I think is just insanity to me. Insanity, okay? Because at the end of the day, the US government does not give a fuck about babies. It does not. It is proven that the US don't care about babies because they give no help to single mothers whatsoever. It is not like there are daycare centers free, there's a lot of healthcare available. There's nothing like that, really. There is not a lot of focus put on struggling mothers. There is a lot of focus put on the fact that Americans don't want women to have abortions. And it is so clear that it's basically just a way that they can feel control over women's bodies. If you think about all the control, all the laws that are on men's bodies, I think there's zero, okay? Don't take your dick out in public, that's one. but we can't take our vaginas out in public, not that we would want to. But there are so many rules on women's bodies, and abortion is just one of those huge ones that people just want to hold on to. Because the minute abortion is made completely legal, they lose that control of women's bodies. They lose that control. They lose that punishment as well. Conservatives are very much like, no sex before marriage, and if you get pregnant before marriage, then that's really your fault. It's a punishment tool as well. It's saying, oh, there's no easy way out of this thing that you got yourself into. But men can't get pregnant. I am under no illusion that if men could get pregnant, you could probably get the Plan B pill at the gas station. No ID necessary. But that's just not a world we're going to live in. So I also would just like to say that the father of gynecology is what he's known as in history. Dr. J. Marion Sims experimented on enslaved black women with no anesthesia. And we are calling this man the father of gynecology. Also, there was a case in the 1950s to 60s. 1950s to 60s, okay? That was not very long ago, okay? There are people alive that were born in that generation. In Puerto Rico, there was birth control trials and women were tested on without their consent. 1950s to 60s. History, American history, the world's history has a long story about treating women, especially women of color, with absolutely no dignity, being able to basically dehumanize them and use them as test dummies. All right, and then if we get back to present day, I have started to read this book, which is fab if you want to read something, Invisible Women by Caroline Criado Perez. And this book is all about how many things in the world today have been tested on men in a very, high stakes kind of vibe, have been tested on men. Seatbelts, medication doses, things that have been certified to be safe for men and not really thought about for women. And men and women's bodies are pretty different, especially when it comes to medication doses. Those things should be tested on both people, but they hadn't really been. And so the dosage that women are taking these days really aren't certified for their bodies. Until the 1990s, drug trials were basically done on men only. Heart disease was labeled as a male disease, and so women would go into the doctor's office with heart disease and would be misdiagnosed a lot. And we also have the case of Viagra versus menopause treatment. Okay, Viagra was fast-tracked to become approved. However, menopause medication or treatment is so underfunded. And here we see women's healthcare optional, men's healthcare very, very important. Viagra over menopause. Currently, and I'm gonna be real with you guys, currently I am trying to have a baby. It's just not really working out the way that I envisioned it to work. And I have been trying to get an OB-GYN appointment for months and months and months, and it has been so difficult. Okay, the soonest appointment I could get was March next year. They said if I get pregnant, then they'll fast track me a little bit, but that would still make me wait a month or two. It is clear that the gynecological area in medicine is very, very underfunded. I wrote down some stats. I searched up some stats and I wrote them down. So I'm going to read them out because they're pretty crazy. Because I was so in shock by how long it took in order to see a gynecologist. It seems so insane. Like, what if there's an emergency? Okay, what if there's an emergency? What if there's something going wrong, but it's not a clear emergency? You just feel like there's something wrong and you need to see a doctor. And you can't see one for months and months. Literally, the first appointment I could get was March 2026. And all I do now is call every single day to see if there's a cancellation because they're not going to let me know. So I wrote down some stats, which is today, okay? Today. Average wait time for an OB-GYN appointment is 42 days. I mean, mine was much longer. This is the longest of any specialty in the medical field. This is up 33% since 2022 and 79% since 2004. Medicaid patients wait 44 times longer than those with private insurance. According to the March of Dimes, over 5.5 million women live in US counties with limited to no access to maternity care, meaning no birthing hospitals, birth centers offering obstetric care, can never say that word, or obstetric providers. In concrete numbers, more than 2.3 million women of reproductive age and about 150,000 babies reside in these maternity care desert areas. As of 2022, 35.6% of US counties, over 1,100 counties, were classified as maternity care deserts, affecting more than 5.6 million women. Between 2010 and 2022, the proportion of rural hospitals without obstetric units rose from 43.1% to 52.4%. Maternal mortality, all right? US maternal mortality rate, 32.9 per 100,000 live births, highest among developed countries, okay? More than 80% of deaths are completely preventable, and Black women are 3 times more likely to die from pregnancy complications than white women. Pain and bias, all right? Women wait longer in ERs for pain medication. Studies show providers more likely to label women's symptoms as stress or psychological. Skipped care. 1 in 3 US women are behind on medical appointments, especially gynecological exams. Top reasons are anxiety, cost, caregiving responsibilities, highest among Gen Z women. And then menopause and contraception. Many US doctors receive little training on menopause. HRT is still stigmatized. Contraceptive burdens fall entirely on women, almost. Male options remain limited to condoms or vasectomy, which most men will not get. I will just end with 2 other cases that were very, very similar to this Sansum TikTok viral trend situation problem. There were 2 other cases, actually. There was the Emory Hospital in Atlanta in 2022, where the nurses mocked patients' icks in labor. They were fired. And then we also had the Rhode Island nurse in 2018 who, on Facebook, made fat-shaming posts. She was also fired. Women in vulnerable medical situations were repeatedly mocked in the US healthcare field. We have to do better. We must do better, okay? There is a long, dark history of women not being listened to or being mocked in doctor's offices, and it needs to end. Because no one wants to go to the fucking doctor. No one wants to go to the doctor. We don't like the unknown. It is scary. Usually we need needles poked in us or things prodded up us. Like, it is not something that people typically would do voluntarily for a fun day out, okay? I remember my parents would have to lie to me all the time about where I was going to go when I was a child because I hated going to the fucking doctor. And I was a child. I did not know much more. I didn't know that much about doctors. So the fact that I still didn't like them, we never like going to the doctors. No one does. And it's the people in the medical field's jobs to make it as comfortable as possible. So please, we have to start doing better. It is essential to the lives of women, literally. The amount of cases of undiagnosed cervical cancer is too much. It needs to be focused on more. It needs to be made more comfortable. And that's all I really have to say for today. This is not just an isolated incident. This is something that is adding to this history that we are really, really trying to get away from. So it's not just a funny little TikTok oopsie, as many people may seem to think it is. It really isn't. It's not. It's way more serious than that. So anyway, that's all I have for today. I love you guys so much. If you haven't gone for your pap smear, please make sure you do. It's very, very important. I know it's horrible, but I swear I'm holding your hand the whole way through. It's unpleasant, but we've all been there. And find a doctor you trust. You know, I know it's hard, and I know it's hard. It's clearly hard to know who to trust. But there are good doctors out there. I promise you that. But yeah, I love you guys very, very much. And I'm going to log off now and try and actually go get a gynecology appointment because it's difficult. It's really, really hard. So yes, I will see you guys very soon. If you haven't subscribed, please make sure you do. It's super helpful to me, and you can see anytime I post anything. And yeah, I love you guys, and I will see you next time. Okay, I love you. Bye bye.